Today, we're jumping into a topic where every single second counts, and where having clear guidance is literally the difference between chaos and control. We're talking about how to navigate a radiation emergency, and we're going to break down the professional's playbook for doing just that.
So let's just put ourselves in the moment. The call comes in. A radiological incident has occurred. It's going to be chaotic, right? Information is probably going to be scarce, and people are looking to you for answers. What is the very first thing you do? It's a massive, high-stakes question. And the answer, well, it needs to be second nature.
And here's the first challenge. A radiological incident isn't just one single thing, It could be anything from a massive nuclear detonation to a localized dirty bomb. Or maybe it's an accident at a nuclear power plant, or even something as seemingly simple as a transportation incident. Every one of these scenarios brings its own unique set of dangers and variables to the table.
This quote, man, it gets to the absolute heart of everything we're talking about. Hope is not a strategy. When a crisis actually hits, sure, adrenaline kicks in, but it's the solid preparation, the clear, rehearsed plan, that's what's going to guide your actions and ultimately save lives. So the real question is, how do you make sure your training is ready for that moment?
Well, here's the answer. It's called REMM. That stands for Radiation Emergency Medical Management. The best way to think about it is like a prepackaged, expert-vetted playbook. It's this amazing, comprehensive web-based resource that's designed to give clear, actionable guidance to people on the front lines, right when they need it most.
And when I say front lines, I mean everyone. REMM isn't just for a handful of specialists or doctors. No, it's designed for the first responders arriving on scene, for hospital staff who are getting ready for a surge of casualties, for mental health professionals who have to deal with the trauma, and even for the planners and trainers who are working to prepare their communities long before anything ever happens.
Okay, so let's crack open this playbook. The first and most critical section is all about managing the patient. This is where we go from theory to the actual bedside.
So let's picture this clinical scenario. A patient shows up a few hours after a known radiation event, and they're complaining of nausea and vomiting. Right away, your first thought has to be Acute Radiation Syndrome, or ARS. REMM gives you the clear priorities. Step 1, triage. Are they facing an immediate life threat right now? Step 2, assess for contamination. Are they still carrying radioactive material on them? And step 3, assess their exposure. How much radiation did they actually absorb? And this is where REMM gives you the actual tools for the job. You get these decision-making algorithms that just cut right through the noise, with specific guidance for ARS. Now here is a key clinical takeaway. The timing of those symptoms, like nausea and vomiting, is absolutely critical. If it starts early, say within the first couple of hours, that suggests a higher, much more dangerous dose. See, the real problem with ARS is that it causes severe bone marrow suppression, which leads to a huge risk of infection. So the management is almost entirely supportive care. We're talking fluids, close monitoring, and really strict infection control. It's all about recognizing the severity early on to guide that care effectively.
But, managing one patient, that's only a single piece of a much larger puzzle. So Section 2 kind of zooms out. It's all about coordinating the entire response, from what's happening at the incident site all the way to the hospital doors.
This part of the playbook provides a really clear, step-by-step timeline for how to act. It starts from the very first moments, discovering and describing what happened. Then it moves to coordinating all the on-site activities and transport. And finally, it ties everything together with what the hospitals need to be doing. It just connects all the dots, so everybody's working from the same game plan.
Okay, now for one of my absolute favorite parts of this resource, because let's be honest, real-world emergencies are never simple. This section dives right into that messy reality. What do you do when radiation is only part of the problem?
I mean, this is exactly the kind of question that keeps emergency planners and clinicians up at night. In the chaos of something like a blast, you're not just dealing with radiation exposure. You're going to have patients with life-threatening physical trauma, severe burns, and radiation exposure, all at the same time. So what do you treat first?
And this is where REMM really shows its practical, real-world value. It anticipates these messy scenarios with this brilliant feature they call management modifiers. These are basically specific adjustments to the standard protocols that are designed for these super complex combined injury patients. And look, here's a critical life-saving insight. See that first line? For a patient with both radiation and trauma, you prioritize the immediate, life-threatening physical injuries. Now, that might sound a little counterintuitive, but the logic is solid. A patient can bleed to death in minutes, while the most severe effects of the radiation are going to play out over hours or even days. The rule is simple: save the life from the immediate threat first. This is the kind of practical wisdom that's just baked into REM.
And finally, that brings us to what might be the most important part of all. REM isn't just a tool for when a crisis is happening, it's a preparedness tool. Because, like the saying goes, the time to learn the playbook is long before the game ever starts.
This is where the real life-saving work gets done, way before an alarm ever sounds. REM gives planners incredibly deep, practical guidance on everything, from developing a local response plan and figuring out how to manage blood supplies, to setting up population monitoring and establishing sensitive procedures for managing the deceased. It really covers the entire life cycle of a response.
So here's the ultimate takeaway. A radiation emergency is one of the most complex, challenging events any community can face. But with solid preparation and the right tools, it is absolutely manageable. In these situations, early recognition of conditions like acute radiation syndrome can truly change outcomes. So the real question isn't just, what's your first move? It's what have you done this week to make sure that move is the right one?